Hi folks, this is training on Orygen Digital's MOST Platform. That stands for Moderated Online Social Therapy. So we have 4 training modules, and this is module 3, before allocation to a Medicare clinician. So we're going to look at a case study briefly, get into the therapy content a bit more, look at how headspace clinicians can use the platform, and also how risk is managed on the platform. So first, let's look at the case study. Jordan is a first-year uni student. He moved to Melbourne from the country and is living alone. He was looking forward to meeting new people when he moved, but then COVID happened. He misses his family and is feeling really lonely. Sometimes he can't sleep at night. He worries about the future. Then he can't get out of bed in the morning. Nothing feels enjoyable anymore. He's close with his mum. She encouraged him to get some help. Jordan found out about MOST when he had his first session with Headspace. He needs to go on a wait list to meet with a counsellor, but they told him that he can jump onto MOST straight away and get some support while he waits. That was a relief. He's feeling pretty desperate for some help. Jordan has been checking out the posts on the community feed. He hasn't posted anything yet, but he feels less alone when he sees that there are other people who feel the way he does. The peer workers seem nice too. He's been thinking about messaging them for a private chat. Jordan got a text message from his MOST therapist and they talked on the phone. They just chatted about how things were going for him and how he could use MOST to get some support. She also explained what the therapy journey is and encouraged him to work on it at his own pace. She said they could talk on the phone every 3 weeks until he gets an appointment with a Headspace counsellor. In between, she said she would message him on the platform to see how he's going, and he can message her too. He likes having one person he can talk to and who knows what's going on for him. It's comforting knowing he can reach out if he needs to. He feels less alone. He's been dipping in and out of the therapy journey. It's cool. It's like reading a comic. And there's not too much information. He doesn't know how much it's helping, but it's sort of nice just reading it. So next, let's have a look at the therapy content. There are currently 4 therapy journeys on the MOST platform, and they're structured around the challenges faced by young people. The first therapy journey is feeling anxious. Deal with worry and find your calm journey. This is therapy for generalised anxiety. Young people learn how to reduce worrying, avoidance, and safety behaviours. The next journey, feeling down. Tune into everyday mindfulness and self-compassion journey. This is therapy to combat depression. Young people learn how to reduce rumination and respond more helpfully to unwanted thoughts, emotions, and physical sensations. The next journey is feeling awkward, overcome anxiety in social situations journey. This is therapy for social anxiety. Young people learn how to challenge irrational beliefs and increase behavioural exposure to feared social situations. And finally, social hacks, from surviving to thriving journey. This is where young people can learn different skills for improving their social functioning. So the therapy content comes in different formats. We have reflective actions, and the message on the platform for young people is reflecting on how the things you learn on MOST relate to your own life, can deepen your understanding of yourself. So this is really the type of action that encourages young people to integrate and reflect on what they've been reading. Here, young people are able to take their own notes, and only they and their MOST therapists can see these notes. Comics are awesome because they can help to expand your knowledge of the journey topic. So the comics express and describe concepts through imagery. Talking point, hear about the experiences of others on the same journey on MOST. If you want to share your experience, it can help those who might be struggling with similar things. So here the young people can make a comment that other young people can see when they complete the activity. So any notes put on a talking point are shared with other young people. Action, Actions invite you to try out new techniques to see if they are a good fit for you. So the sorts of actions that a young person might try here are things like a mindfulness exercise or an exposure activity. And finally, strength-based action. Strength-based actions help you use your unique strengths and build new strengths to achieve your goals. So young people also have their own personal toolkit. So here is where they can save whatever therapy content that they've found helpful for future reference. So they effectively build up their own personal therapy library. And then there's the explore function also. So if a young person doesn't want to go through the structured therapy journey when they log on a particular time, they can go to the explore section and explore therapy content according to topics. So for example, they could press the feeling distressed topic and they would see the sorts of activities and content there for managing distress and distress tolerance. So next we'll look at how Headspace clinicians can use the platform while a young person is on the wait list, and also how we manage risk on the platform. So if an access team clinician, a student clinician, an enhanced care coordinator is working with a young person while they're on the wait list for a Medicare clinician, they can jump onto the platform and review the following types of information. And these are just examples. They can see how the young person is engaging with the online supports, for example, the social network. Are they chatting with their most therapist or peer workers? They can see how much the young person is engaging with the therapy content. For example, how much have they completed on a therapy journey? What have they found helpful? And what have they saved to their personal toolkit? And they can also see the MOST therapy team's clinical formulation for the particular young person. So how we manage risk on the MOST platform. A young person is potentially communicating on a social network, in messages with their MOST therapist, with peer workers and career consultants, as well as writing notes on their therapy journey. The MOST therapy team monitors and manages risk on the platform. The platform is designed to detect and flag potentially risky or offensive content, and this is reviewed by the MOST therapy team during their regular safety checks. Content that is tagged as potentially risky or offensive is removed from public view until it's reviewed by the MOST therapy team. So where the MOST therapy team has assessed a young person and managed a significant elevation in risk, this will be communicated to the Headspace Centre. Medicare clinicians can share a management plan to guide the MOST therapy team in their response to managing risk for a young person. If the Medicare clinician identifies potential risk when chatting with a young person via MOST, the expectation is that they will communicate this to the MOST therapy team and take any other action that they consider appropriate. So what if a young person tells you that something's not working for them on MOST and they're having some problems with it? So effectively what we'd like you to do is request that the young person log that difficulty on the MOST platform so they can directly communicate with the tech and help desk. So there's a feedback function on the platform where they can report a bug with the platform, but they can also log suggested improvements or new features that they'd like to see on the platform. And we'd also request that in your own engagement with the platform, if you are having an issue using the platform and you feel that something's not quite working, again, we'd encourage you to log that via the feedback function as a really direct way of dealing with our IT and tech team. And where do you go if you have other sorts of questions or need help with MOST? So putting aside those more sort of tech questions, we'd encourage you to approach the MOST champion, who's the go-to person for MOST in your service, and also the clinical implementation facilitator for Headspaces, who's Mira. We're also developing frequently asked questions for services and other Orygen digital resources, including these types of online training sessions. Where can you pass on feedback or suggestions, including suggested improvements about MOST? Again, you can do this via the feedback function on the MOST platform, or if you prefer, you can direct this information to your MOST champion and also to Mira. Thanks.